A fracture is a break or disruption in the continuity of a bone, epiphyseal plate, or cartilaginous surface. If the broken bone punctures the skin, it is called an open or compound fracture. Fractures commonly happen because of car accidents, falls, or sports injuries. Other causes are low bone density and osteoporosis, which cause weakening of the bones. Epiphysis bulbous proximal or distal end of a long bone. Metaphysis section of bone between the epiphysis and diaphysis of a long bone. Diaphysis shaft of long bone. Physis growth plate. Without manipulation method. No manipulation or open reduction is required. No incisions are made. The fracture is determined to be stable and non-displaced and can be splinted or braced without requiring manipulation. Treatment involves immobilization, using one of several methods, until union is established. With manipulation method. Manipulation is required to reduce an unstable and/or displaced fracture or epiphyseal separation. Analgesia or sedation may be necessary to achieve reduction. The physician manipulates, pushes, pulls, or moves the area to align the fractured pieces. The physician may apply traction devices to the body to maintain satisfactory fracture reduction. A brace, splint, or cast may be applied to hold the bones in the correct position until they are healed. Skin or skeletal traction may also be applied. Pins, wires, or tongs are inserted into the bone for skeletal traction through a small incision without opening the fracture. A weight and pulley system is attached to exert a constant force of traction and keep the fractured bones in alignment. Closed treatment of proximal humeral, surgical or anatomical neck fracture, without manipulation. With manipulation, with or without skeletal traction. Closed treatment of greater humeral tuberosity fracture, without manipulation. With manipulation. Closed treatment of humeral shaft fracture, without manipulation. With manipulation, with or without skeletal traction. Closed treatment of supracondylar or transcondylar humeral fracture, with or without intercondylar extension, without manipulation. With manipulation, with or without skin or skeletal traction. Closed treatment of humeral epicondylar fracture, medial or lateral, without manipulation. With manipulation. Closed treatment of humeral condylar fracture, medial or lateral, without manipulation. With manipulation. Closed treatment of radial head or neck fracture, without manipulation. With manipulation. Closed treatment of radial shaft fracture, without manipulation. With manipulation. Closed treatment of distal radial fracture, e.g., Coles or Smith type, or epiphyseal separation, includes closed treatment of fracture of ulnar styloid, when performed, without manipulation. With manipulation. Closed treatment of ulnar fracture, proximal end, e.g., olecranon or coronoid process ES, without manipulation. With manipulation. Closed treatment of ulnar shaft fracture, without manipulation. With manipulation. Closed treatment of radial and ulnar shaft fractures, without manipulation. With manipulation. Closed treatment of fracture of weight-bearing articular portion of distal tibia, e.g., pylon or tibial plafond, with or without anesthesia, without manipulation. With skeletal traction and/or requiring manipulation. Closed treatment of tibial fracture, proximal, plateau, without manipulation. With or without manipulation, with skeletal traction. Closed treatment of posterior malleolus fracture, without manipulation. With manipulation. Closed treatment of medial malleolus fracture, without manipulation. With manipulation, with or without skin or skeletal traction. Closed treatment of tibial shaft fracture, with or without fibular fracture, without manipulation. With manipulation, with or without skeletal traction. Closed treatment of distal fibular fracture, lateral malleolus, without manipulation. With manipulation. Closed treatment of proximal fibula or shaft fracture, without manipulation. With manipulation.